Hello and good morning. Today we are going to be doing a presentation on female genital mutilation, the ethics behind female circumcision. I'm Brock.
Kristen Tweet.
Alex Upsall.
Not present is Shay Brown, however she did contribute significantly to this presentation.
So genital mutilation in general, what is it? It is the partial or total removal of female genitalia or other injury to the female genitalia. This is a cultural and traditional practice. They consider there to be 4 types of female genital mutilation. You have clitorectomy, which is partial or total removal of the clitoris and or its prepuce. You have excision, which is the clitoris and labia minora are partially or totally removed with or without the labia majora. And then you have infibulation, which is the narrowing of the vaginal orifice with creation of a covering seal by cutting and positioning the labia minora or majora with or without the removal of the clitoris. And then the 4th type is general unclassified genital injuries or non-medical injuries. So these are all other procedures for non-medical purposes, such as piercing, scraping, incising, and cauterization. This diagram shows the different types of female genital mutilation. Upon first glance, we thought that this was just depicting the 4 types that I had previously listed. Upon further review, we noticed that this was actually just types 1, 2, and 3. The first diagram shows type 1, which is the clitorectomy. So this is removal of the clitoris with a blade or some type of sharp object. The clitoris in the female anatomy is one of the parts of the female anatomy that allows orgasm to be reached. So without this part of the body, a female is not able to reach orgasm or is not as able to. Type 2 shows an excision. So this is removal of the clitoris or labia minora. So as I previously listed, without the clitoris, it is harder to reach orgasm, and the labia minora protects the vaginal opening. The diagram 3 and 4 are showing infibulation. We initially thought this was showing infibulation and non-medical, but notice that this is actually a 2-part of female genital mutilation. So diagram 3 is showing removal of the clitoris, labia minora, and labia majora. And then with these parts removed, they are using some type of instrument to sew up the vaginal orifice and completing the female genital mutilation. One statistic we found is that 90% of the female genital mutilation cases are either type 1, the clitorectomy, type 2, the excision, or type 4, the non-medical or piercing and cauterization. Type 3 is actually only 10%, found in 10% of females, but this 10% still consists of over 8 million women worldwide. Who and where does female genital mutilation take place? More than 200 million females worldwide are affected by this procedure. A majority of the females are cut before the age of 15. 92 million girls undergo female genital mutilation before the age of 10, which is below the age of consent in many countries. More than 3 million of these girls are at risk every year for female genital mutilation. Females in Africa, the Middle East, and Southeast Asia are at the highest risk of this procedure. Data was collected and found in more than 30 countries in these regions have the highest prevalence rate of this genital mutilation. A survey was taken of women between the ages of 15 and 49 out of these 30 countries. 8 of these countries had a prevalence rate of over 80% between the women and daughters of having female genital mutilation.
For female genital mutilation, there are proponents and opponents to this fact. And for the proponents, there are the patriarchal families and tradition, cultural influence, hygiene, social acceptance, and psychosexual norms that are the arguments for the proponents. And some of them are that the belief is that there's a need to have this procedure in order to bear children, that the circumcision helps to keep the area clean and help to make the women feel less dirty in the sense that it's not a gaping hole. The clitoris is toxic and would harm babies if the baby touched the clitoris during childbirth. The clitoris is actually a male part that needs to be removed for them to become a woman. It can be viewed as a coming of age ceremony and is remembered as a happy time with a festival, gift giving, and sometimes it's done in order to be socially accepted. The girl needs to be mutilated to be able to get married. This also can reduce sexual thoughts and urges and helps to maintain the purity of the girls. And then for the opponents, some of the arguments are that there are no health benefits, that there are immediate complications such as severe bleeding, excessive swelling, infection, shock, and even death. And then some of the long-term complications would be urinary problems such as like painful urination, urinary tract infections, vaginal problems such as discharge, itching, bacterial vaginosis, and other infections. The menstrual problems, having painful menstruations, difficulty in passing menstrual blood, things like that nature. There can be scar tissue and keloid. Sexual problems, pain during intercourse, decreased satisfaction, etc. Increased risk of childbirth complications, such as difficulty delivering, excessive bleeding, cesarean section, a need to resuscitate the baby after birth, and even newborn deaths. A need for later surgeries, for example, the female genital mutilation procedure that seals or narrows the vaginal opening, which is the type 3, would need to be cut open later to allow for sexual intercourse and childbirth. Sometimes the genital tissue is stitched again several times, including after childbirth. Hence, the woman goes through repeated opening and closing procedures, further increasing both immediate and long-term risks. The psychological problems are among different factors like depression, anxiety, post-traumatic stress disorder, low self-esteem, and many others.
The ethical principles involved with female genital mutilation need to be looked at. And the first place we need to look is at terminology. Terminology is super important for anything. It allows for a common tongue and allows people to go ahead and concurrently describe a situation at hand, or gives a way to talk about things in a culturally sensitive manner. Some definitions that I really think are important here is to actually look at the term ethics and what it really means. Merriam-Webster defines ethics in a plural form, that it is the discipline dealing with what is good and bad, with moral duty and obligation. And ethics in and of itself should go ahead and be a guideline for religion and not the other way around. And this comes from the idea that if your religion is going ahead and saying that it's important to go kill everyone, ethically that's wrong. So you need to go ahead and look at that. So another thing that is important to look at is to look at the words good and bad. Good and bad are very subjective terms. What is good for me is not good for Kristen or good for Alex necessarily. And what is bad for me is not necessarily bad for them or is viewed as good for them. So something just to think about, and I'm not going to answer because it's important that people reflect on these questions, are, a question of what are the implications of determining right and wrong in a religious construct? What does that mean? What is good? What is bad? And what does that mean for religion? A couple ethical arguments for female genital mutilation include that it is based in religious practices. So for someone to go into a religious practice and say this is wrong, that in and of itself is an unethical action. And then and denying someone from practicing a religion, that would also go along the same lines of being unethical, because that would be considered bad, preventing someone from exploring that form of spirituality and religion. And then another good question to ask here is, what if those practices of that religion are unethical, as is the case of female genital mutilation? What do you do? What interventions do you do? As a future healthcare professional, what do you say? How do you act in these situations? These are things that need to be thought of, not only for female genital mutilation, but in other areas like vaccinations, circumcision, elective procedures, and so on and so forth. The definition of principle is a comprehensive and fundamental law, doctrine, or assumption. Fundamental law is like the laws of nature. We know exactly what's going to happen. Religions are based on what believers find as fundamental principles, the good versus evil. And they outline as to what is ethical in terms of that religious practice. So when we look at ethics and principles and what the ethical principles of female genital mutilation can include, you really have to ask yourself, is there a violation of ethical principles? Personally, and our group and the World Health Organization has essentially condemned female genital mutilation or circumcision. So, like previously stated with Alex, this practice is majorly occurs predominantly in Muslim countries and under the religion of Islam. And Islam is heavily founded in a patriarchal framework. So that means that the man says everything, controls everything, which we know is not a good thing, but that's my own 2 cents. But in reality, women should maintain at least autonomy of their own body and what happens to it. So this framework can be applied to rape. Rape, we know, is condemned and it is wrong. It is removing the power and the decision of a woman or person, whoever is involved. So why does this extend beyond that? There's no medical benefits to female genital mutilation or castration, and it creates more harm than good. So there's no medical backing behind female genital mutilation or circumcision. This ultimately results in a complete violation of ethics and principles. As medical professionals, we take the Hippocratic Oath, and that means that we do no harm. So people that are participating in these type of procedures are doing harm, violating their own Hippocratic Oath, and this contributes to a human rights violation. Potential outcomes for the patient, healthcare system, and the cost of healthcare and the providers should be looked at whenever any procedure is performed. For the patient outcomes for female genital mutilation include acceptance into their culture and side effects that do include pain, swelling, risk for infection, and long-term complications. Conversely put, women in these areas are expected to conform to cultural and societal customs, and if they do not undergo these practices, they're often bullied, ostracized, and put down by their communities. And it is often reported that bullying and dishonor to the family and or tribe do occur for not conforming to this practice. Within the healthcare system itself, the nurse and provider need to know if it is legal to perform these procedures within their place of employment or the country that they're practicing. If there are complications, medical staff need to provide services to assess the individual in need. The outcome for the healthcare system would include the need for healthcare workers to be respectful of other cultures and differences in beliefs, never, ever, ever shaming a patient or family for something they are not in control of, or just in fact never shaming a patient ever. Always know your reporting procedures. Because this is condemned by the World Health Organization, as well as many countries, this needs to. And the cost to the healthcare system and to the individual can be quite immense. If this procedure occurs outside of a hospital setting, they are more likely to experience complications, and they will eventually come to the hospital seeking further treatment, increasing the cost of care. And then later on, considering vaginal reconstruction, you're looking at an expensive procedure, you're looking at pain, you will not regain complete sensation, painful sex, and difficulty and or loss of achieving orgasm.
There are cultural, theological, and spiritual implications we found towards female genital mutilation. As previously noted, related to cultural implications, it can be seen as a rite of passage into womanhood, and some females may not be allowed to be married until they have the mutilation occur. Also, speaking from the parents' perspective, many parents believe they are doing the right thing for their daughters. Parents making these decisions tend to be illiterate and tend to with access to evidence-based practice would be unable to discern the information, so they would not know the risk and all the dangerous factors that they are putting their daughters at risk for.
And then the spiritual implications, the main point behind that would be to keep the women worthy and healthy for marriage and childbearing and so forth for those different religions and beliefs. For the theological implications, it keeps the women from being promiscuous. Premarital virginity is seen as a guarantee of moral standards, and also maintaining the virginal standards. It reflects not only honor on the person and the family, but to the wider community as a whole. One of our studies quoted that the greatest measure of a family's honor is the sexual purity of its women, and that if any transgression on the part of a woman disgraces the whole family. And additionally, this also keeps the women from being unfaithful. The purpose of a woman is to have babies, which is part of the theological implications, and their satisfaction is of little to no concern. For the nursing practice implications, there is an impact on nursing with female genital mutilation. We can look at the identification of it, the different nursing roles, who identifies who identifies the female mutilation first, the awareness, the reporting aspect of it, understanding the culture and history behind the female genital mutilation, the need for the eradication of it, and also the health problems that are incorporated with the female genital mutilation. So, like nurses in schools, community, travel nurses, practice, sexual health, neonatal, accident, and emergency and gynecology, they all work in sectors where female genital mutilation can be found. Nurses can also be the first to identify women who have been through mutilation, and awareness may include best practice when dealing with female mutilation and knowing what mutilation is, where it is carried out, and how to prevent it, and the physical and emotional support programs that are available for those that have been through it. Reporting an actual case of female genital mutilation is important to report that to social services to try and provide safety and awareness to those women and girls who have gone through that mutilation. Understanding where the girls and women come from are in regards to the cultural significance of the mutilation can help improve care for the women. Eradication of female mutilation our group believes is important to benefit the health and status of the millions of women around the world. And some of the health problems that can include like urinary problems, infections, severe pain, and psychological health problems, as we discussed earlier, are very important for this eradication feature.
These are our evidence-based references, and in conclusion, we find that female genital mutilation is an outdated, unethical procedure with no health benefits. It affects millions of women and girls worldwide, resulting in numerous present and future physical and emotional complications, even though these practices are condemned by the World Health Organization. As a cultural practice, extreme sensitivity and empathy needs to be observed when identifying and caring for women and girls who have undergone female genital mutilation. Thank you for your attention throughout our presentation, and if you have any questions, please feel free to contact us. Thanks again.